So the reason I became a physiatrist, a specialist in the field of physical medicine and rehabilitation, is because of an amputee. Years ago, when I was in medical school, it was an easy decision for me to be a doctor, but then what kind of doctor? I know I wanted to be a good doctor, but I didn't know what kind of doctor, what specialty. And so my older sister was an occupational therapist, and she said I should do physical medicine rehab. She said I should do rehab medicine. So I did a rotation in rehab medicine at Nassau County Medical Center in Long Island, and they assigned me to a young resident, and I hung out with him, and he assigned me to a patient who lost both their legs after he had open heart surgery. He had low blood flow to both legs, Bernie, and Bernie lost both legs. One leg below the knee and one leg he lost at the ankle, called a Symes amputation. And I went in the room to see him, and I examined him as a fourth-year medical student, and he told me he wanted to die. And it hurt me. I'd never met anybody who told me they wanted to die. I didn't know what to say, and I didn't know what to do. He didn't want to live like that anymore. And so I kind of left the room, and the next day I came back, and his wife was there. And I talked to the wife, and I asked him how many grandchildren. She told me he had 6 grandchildren. I asked her to bring in the pictures of all the grandchildren and put them on the windowsill. And she did. And he wasn't happy with me the next day. When I went in the room, he said, "Why'd you do that?" And I said, "Well, those are the grandchildren is who you have to live for. Do you want them to, this is what you want them to think of their grandpa?" And he called me an expletive, and he then started to do his rehab. And the head of that department was a specialist in amputee medicine, had actually written books on the subject, and he taught me how to take care of an amputee. And at that time, we actually were able to get prosthetics for that patient, artificial limbs, while he was in the hospital. And Bernie walked out of the hospital with a smile on his face, and he didn't call me that bad word anymore. And for 15 or 16 years, he found where I was. He'd seek me out, and I'm not sure how, but I got a Christmas card from Bernie every year. So the reason I became a physiatrist is because of an amputee. That's why.